Hello, everyone, and welcome. This week, we will be reviewing coding. We will do an overview, and so we're going to go ahead and get started. My name is Cynthia Bennett, and I will be your facilitator. So, a career as a coder. So, a coder acquires working knowledge of all of the coding systems, such as your ICD-10, your HCPCS, CPT, and your ICD-10 PCS. So there are several coding systems that you will be learning. These coding systems and conventions are used by government programs, third-party payers to ensure that all diseases, injuries, and reasons for an encounter, services, and procedures are coded accurately for reimbursement. They're also used for research and statistical purposes. So many times coders think that this information is only used for reimbursement, but it's also used for research and other statistical purposes. So always like to share that information because sometimes we're thinking just reimbursement. So the training that's involved. So for a coder, normally they're going to go to a college-based and non-credited programs. They're normally going to be health sciences courses, coding and reimbursement courses, a coding internship, and this could be at a healthcare facility, internship with a supervisor, and then also provides on-the-job training. So these are some of the credentials that a coder could possess. One is through an organization called AHIMA, which is the American Health Information Management Association. They offer the certifications of CCA, CCS, CCSP. Another organization is the AAPC. They offer the certifications of the CPC, which is your Certified Professional Coder, the CIC, which is your Certified Inpatient Coder, the COC, which is your Certified Outpatient Coder, and then your Specialty Coding Certification credentials. So they offer a variety of coding credentials through both organizations, not just the ones that we have listed here. So employment opportunities, and this is why everyone is here. We want to have the opportunity to work. So you can work in many different healthcare settings, such as a hospital, a nursing home, business office, an insurance company. So there's a lots of places that you can work within the healthcare setting. You can work at a consultant firm, governmental agencies, health insurance companies, and then other professions that are related to coding include health insurance specialists, claims examiner, and medical assistant. So these are just a short list of the different opportunities that you can have while you're in this particular field. So many opportunities to branch out and to do other things and not just do one position. So your training is definitely preparing you for the workforce. So these are just a list of some professional organizations. So the first one is for coders. This is the AAPC. We also have the American Health Information Management Association. So those are two organizations that you can join as a coder. As a health insurance specialist, you can consider Alliance of Claims Assistance Professional. And then we also have the Medical Association of Billers. For medical assistant, we had the American Association of Medical Assistants, and then we have the American Medical Technologists. So again, we have a different variety of certifications and organizations that can get you certified in your new career. So here are some of the websites that you can visit to get more information. The first one is www.ahima.org, and this is for AHIMA. We also have the AAPC. You can go to aapc.com and click on the forum link and scroll down to where it says medical coding. You also can go to Medicare Part B, and their website is www.partbnews.com, and you'll hover over communities and select the forum from the pop-up menu. And there's many coding discussions on there. They talk about all different types of coding. And then they also have information sometimes about job opportunities. So great websites that you can go and take a look and find out some additional information. So the coding systems and coding processes. So as you can see, there's multiple coding systems. So the first one we'll talk about is the ICD-10-CM. Now this is for your diagnosis. ICD-10 PCS is for different types of procedures, and these procedures are normally going to be done um, through a hospital organization. A lot of them will use the PCS. Most physician offices do not use the PCS. The next set of coding systems is your CPT, and this is going to be for your procedures, and this is going to be used by mainly physician offices. Some hospitals may use a little bit of them, but mainly physician services, they will use the CPT. Then you also have your HCPCS level 2 that also will need to be completed. So these are just some of the variety of the coding systems that will be available. So those are some of the most popular ones. We also have HIPAA code sets, which the larger code set is for your CPT, and your smaller code set is going to be used in different healthcare settings. So one of the things that we want to do while we are doing any type of reimbursement is we want to avoid fraud and abuse at any cost. So these areas are very, very important. So one of the areas is unbundling. So this is when you're reporting multiple codes to increase reimbursement when a single combination code is available. So sometimes you will have a single combination code that's available for something that some procedures will have two things. So for example, you can get an MRI with contrast and without contrast. So there is a code that you can use that will cover both the with and without. So that's what they mean when they say unbundling. If you try to build the two separate codes instead of using that single combination code. The next one is upcoding, and this is when you are reporting codes that are not supported by the documentation that is in the patient's record for the purpose of increasing reimbursement. So make sure that the documentation that's in the record supports the actual code that you are assigning. So sometimes this happens if the documentation supports a level 2 office visit, but we bill a level 3 office visit. So that will be an example of upcoding. So overcoding, this is reporting codes for signs and symptoms in addition to the established diagnosis code. So we just want to report the signs and symptoms for the actual disease that that patient came in for. Another one would be jamming, and this is routinely assigning unspecified ICD-10 codes instead of reviewing the coding manual to select the most appropriate code. So we want to always select a code that's the closest to the reason why that patient was seen. And then the next one is down coding. So this is routinely assigning lower level CPT codes for convenience instead of reviewing the patient's record and the documentation and the coding manual to determine the proper code to be reported. So we don't want to just download codes either. That's actually improper as well. So we want to make sure that we're coding exactly what is in the patient's chart. So what is matching the actual documentation. So in the medical coding process, We want to always make sure that we adhere to the code of ethics. And so the code of ethics will be through your employer. And then it's also a code of ethics that's going to be through the organization that gives you your certification. They have codes of ethics as well. We also want to follow steps to accurately code. We always want to do that. Make sure that we're accurately coding, because remember, they're using this information not only for reimbursement, but also statistical reasons as well. So we want to make sure that our coding is always as accurate as possible. We also want to ensure coding quality. So make sure our coding is meeting the quality standards. So we always want to do that. We should never, ever assume anything in coding. So don't make any assumptions. So we're only going to code what is exactly documented for that visit, nothing else. Even if we know that something else took place, or we assume that something took place because the doctor normally does another procedure with that, we cannot do that. We only can code what is on the documentation. Use the physician during the query process. So ask them questions. If you're not sure, go back and ask the doctor, did this occur? Did that occur? And then ask them to document it as well, because we still shouldn't be billing if it's not documented. Or maybe they documented it somewhere else. So we always want to make sure that we query the physician or our supervisor or manager if we're not sure about something. And then we definitely want to comply with clinical documentation improvement and coding compliance programs. So most organizations will have a coding compliance program. So we want to make sure that we are following those rules and regulations that they have set in those programs. So there's also professional coding versus institutional coding. So for our professional coding, this captures the complexity and the intensity of procedures performed and services provided during an outpatient or a physician office visit. So that's where professional coding will occur. You also have institutional, or you may hear people say facility-based coding. And this coding captures intensity of services used to provide inpatient care and the severity of the illness to classify how sick inpatients are. So they will do what we call institutional coding. Then we also have multi-systems, multi-hospital systems, and they provide physician services, physician office services, and have implemented a single path coding, which combines professional and institutional claims. So this is going to be not as popular as the first two that I mentioned, but there can be times when a multi-hospital system will do a combination of professional and institutional coding. So to improve productivity and to ensure the submission of clean claims, leading to improvement of reimbursement. Clinical documentation improvement. This helps to ensure that we are coding accurately and thorough according to the patient's record. And it identifies any discrepancies between the provider documentation and the codes that are being assigned. So we want to make sure that we're always coding and assigning codes that matches the documentation. Coders who have questions about documented diagnoses, procedures, and services use a physician query process to request clarification about the documentation that impacts the appropriate code assignment. So when you have those gray areas, it's okay to contact the provider or contact your supervisor, however the process is at that location, to clarify anything that you're not sure about. For the physician query process, coders may coordinate with utilization management employees who routinely meet with providers about medical necessity of continued patient stays. So this one will be more so for your inpatient because they're talking about patient stays. Your coding compliance program, very, very important as you are working in healthcare and you're doing coding. So most organizations will have a coding compliance program. And what this program does is it ensures that the assignment of codes, procedures, and services follows established coding guidelines, such as those that are published by CMS, which is the Centers for Medicare and Medicaid. Healthcare organizations, they will write policies, guiding principles that indicate what to do, and procedures, which these are the processes that indicate how to do it, and to assist in implementing the coding compliance stages of detection, correction, prevention, verification, and comparison. So many healthcare organizations will opt to do what we call internal audits, and they'll do them on a regular basis. Sometimes it's quarterly, sometimes it's semi-annually, sometimes it's annually. Even in some cases, it may even be monthly. So there are certain audits that may occur to help with the compliance program. And then the next one is effective coding and compliance program monitors, which they will be monitoring the coding process for completeness, reliability, validity, and timeliness. So as I mentioned before, this is at every organization. Most of them will have a coding compliance program. So the documentation as the basics for coding, you're going to have the patient's medical record, and this is the business record for the patient's encounters. And this could be inpatient or outpatient that document health services provided to the patient. So basically, what occurred when that patient came in for that visit. Also, continuity of care. This is documenting patient care services so that others who treat that patient have source of information on which to base additional care and treatment. So the documentation is used for that as well. And then documentation is dictated, transcribed, keyboard, or handwritten, and computer generated notes and reports are recorded in the patient's record. This will depend on the office location and how they actually do things. Rather, it will be one of these listed above: dictated, transcribed, keyboard, or handwritten. And then some doctors actually do their own notes right there while they're with the patient. Medical necessity. This is the patient's diagnosis must justify diagnostic and therapeutic procedures or services that are provided. So the diagnosis is going to tell the insurance company why that patient received that service based off of the diagnosis. It requires providers to document services or supplies that are proper and needed for diagnosis or treatment of a condition, provided for diagnosis, direct care, and treatment for medical conditions consistent with standards of good medical practice in the local area, and not mainly for convenience of the physician or healthcare facility. And you'll hear this a lot. If it wasn't documented, it wasn't done. So everything must be documented. We should never code unless we have documentation. Even if the doctor tells us to do it, if we don't have any documentation to compare it with, we really shouldn't actually assign any codes because we don't know what to assign it with based off of we don't have any documentation. So that's what they mean when they say if it wasn't documented, it wasn't done. So we always want to make sure everything we do has documentation to back up whatever we are submitting. So health data collection. So this is performed for the purpose of administrative planning, submitting statistics to state and federal government agencies reporting healthcare claims data to third-party payers. This is normally going to be done on an automated software. If it is outpatient, it's going to be the 1500 claim form. If it is inpatient, it's going to be the UB04 claim form. Also, we'll have generation of reports. And then for reporting physician office data, they will be using just the CMS 1500 claim form and then a medical management software. And then also a generation of reports, including the accounts receivable aging report. So many offices will use that aging report to look at accounts, and this will tell them how long that account has been pending for payment. Okay, and this will conclude our presentation for today.